being here. Appreciate it. So we were here a few weeks ago to announce that we would do a drive-through vaccination site in the villages, and there was a lot of demand, and they went through that very quickly. But I said, look, the places that are doing well, that are showing that they can use these doses, as we get more vaccine delivered, we're going to make sure that we send more vaccine into those communities. And so we had been getting about 266,000 initial doses delivered in the state of Florida from the federal government over the last several weeks. This week coming up, today, tomorrow, Wednesday, the deliveries will total about 307,000 initial doses. So that's about a 40,000 dose increase. And because of that increase, we are able to announce that beginning this Thursday, that drive-through site will be able to be open again, but this time it's going to be a permanent vaccination site. We're going to feed 4,000 doses, initial doses, to that site on a permanent basis, as long as our supply remains what it is. So the site will be, in addition to other permanent vaccine location in Sumter County at the Wildwood Community Center, which has also been good, but we have a lot of seniors here, there's a lot of demand, and we think that this drive-through site will work very, very well. So we're happy to do it. So you have 4,000 doses of the Moderna vaccine for this week's shipment that's going to be allocated. We think it'll probably arrive sometime tomorrow, and then people will be able to sign up, and then Thursday you'll start having the cars go through. And of course, if we get another 40,000 on top of the 307,000, we could do even more than 4,000 here, and we're happy to do that. It's all contingent upon the supply that's being sent to the states from the federal government. But this was a very well-run site. I was able to be here. I spoke with a number of the seniors. They were very happy with how it went. And so when you know that something works, you want to continue to see that go. So to schedule an appointment, you can visit sumterfl.saferstart.net. Also this week, in addition to this Villages site where we're going to have drive-through testing, we're going to do a pod in the Sun City Center area. So last week I was in Sun City Center to announce for the Sun City Center community that we would do 5,000 doses, drive-through, golf cart driving as well. It's similar community to the Villages in that respect. Was very well run, is very successful. There was also a senior community across the street from Sun City Center called Kings Point. And so we already have the infrastructure in place at Sun City Center. So this coming week, there'll be 5,000 additional doses for the residents of Kings Point, which is also another senior citizen dominated community. So we think that the Sun City Center has gone very well. People are happy. Folks across the street at Kings Point said, hey, what about us? And so we said, yeah, we'll get you some. We're also doing a pod of 3,500 in Palm Air community in Broward, and we think that that'll go very well as well. So when you're talking about places like the Villages, which is obviously the big enchilada in Florida, but all these other senior communities, you're able to get that vaccine in there. You got a lot of folks who want it. It's very convenient, and we really can get a lot of shots in the arm. So we're excited about the Villages site, but we're also excited about those other sites as well. And so far, Florida has done a higher percentage of its vaccinations to senior citizens than any other state in the country. We decided, the first state in the country, to put seniors first. That has been our goal. That's been our policy. We haven't wavered from that. And of course, now many states are following Florida to put seniors first. We are reporting about 1.25 million seniors that have had at least one shot, but I would caution everybody, we're finding these reports are lagging by sometimes 4 or 5 days. If you go back and look 7-10 days ago, those numbers have kind of kept growing. Even the week after, they kind of do. So we believe that there are a lot more people that have actually been vaccinated than are necessarily reported. The reports come in, and obviously we do it. But I'm worried about when the shots are getting in arms. Like, I want the one instantaneous reporting, but the reporting to me isn't as important as the fact that the shots are doing. And so we're now getting close to 30% of our senior population that has had at least one shot. And again, that is either #1 in the nation or very close to #1 in the nation in terms of what percentage of our senior population has gotten a shot. And we have a very large population. We have 4.5 million. So That is what we're seniors first, and we're going to continue to do that. We think it's the right strategy. Now, we also have, in many counties, Publix pharmacies, 20 different counties, 261 pharmacies. We hope to be able to announce some additional Publix in the very near future, and so stay tuned on that. But that allows folks, particularly in areas that may not have as robust of hospital systems as some of the other places. If you look at like Orlando, they've done a lot with their hospitals. They've done a great job. You look at just further south and in South Florida, some of those systems have done a great job. Some of these Publixes have really filled a need getting into communities in a convenient way where folks are able to go and do that. So there's 261 of those throughout the state. And as I said, I think we're going to add more very, very soon. We've also worked with county health departments, and we're supporting 77 additional community vaccination sites. We've also done 25 vaccination events at places of worship in 15 different counties, and we're going to continue with that program, which we believe has been very successful. So we're going to do another 23 houses of worship this week. So from doing the nursing homes and the long-term care facilities to doing senior communities, starting at Kings Point down in Delray Beach before the new year even started, obviously the villages and other like-minded, similar situated communities. There's a lot good. One thing we're also going to be doing this week is setting aside a small number of vaccines, about 1,500 initial doses for homebound seniors. So you have folks who may not be able to go to a drive-through site, may not even be able to go to the grocery store or the hospital. So those are folks that we want to be able to provide vaccines for. So that effort is going to begin this week as well. And I think that that's something that's good. Now, some hospitals have already been doing that because they have different clients who they are already doing different types of treatment in homebound. But we know there's other folks who may not be able to be as active as a lot of seniors in the villages, quite frankly. So we want to look out for them too. So our ability to vaccinate seniors can increase dramatically just based on additional supply. So we hope we continue to see increased supply. I think that there's a lot of capacity with hospitals who are, they're now getting some more vaccine. They did a good job working through what they had over the first 4 or 5 weeks. We're going to continue feeding these sites, but every single site we have can just simply be expanded. So if you have the drive-through at the villages, you're going to do a certain number a day. We can just add another lane or two, if we have sufficient number of vaccines. So we're hoping we're able to do that. Final thing I'd point out is we got some really, really good news about the phase 3 clinical trial data from the Johnson & Johnson vaccine. And if you watch some of the headlines and reports, it was like, oh, not as effective as Pfizer and Moderna was what I was seeing. And I was like, oh man, that really stinks. But then you look at it, and yeah, they said 66% efficacy in terms of preventing infection, and it was higher in the U.S., but they looked at all worldwide data to come up with that. But after 28 days, one single dose of Johnson & Johnson vaccine was found to be 100% effective at preventing death, and almost 100% effective, practically 100% effective at preventing hospitalization. And so, look, to me, if no one got infected, fine, but if you have something that will rule out fatalities and rule out, for all intents and purposes, people even being admitted to hospitals, that is a successful vaccine. Sign me up for that. And so we look very forward. They're going to be submitting an application for emergency use authorization probably this week, maybe next week, but very soon. If you look at the way that the FDA handled the Pfizer and the Moderna, once that application is filed, they then set a date where they will then convene. So that was, I think, 7 to 10 days after the application was received. And that would mean, under that timeline, we could get an approval for emergency use this month of February, which would be a really, really good thing. So I see a one-dose vaccine, very easy to store. You don't have to have -70. You don't even have to have freezer. You just put it in the refrigerator. You jab it one time, and then you don't have to worry about people coming back for the booster shot. So, and we'll get more data. There'll be more put out beyond just what Johnson & Johnson has done. And even if it's slightly less, quote, efficacious than Pfizer, Moderna. For workforce people, for folks that may be younger with comorbidities, to me, this is something that we should be very excited about. When you're looking at all but preventing severe disease after 28 days, to me, that's the whole name of the game. I don't think we would change society because somebody has a cough for 2 days or has a cold for 2 days. I mean, those are normal, mild maladies that we see all the time, regardless of COVID. So if that is the worst that would happen with Johnson & Johnson, to me, that's something that's very, very positive. So I think the data was better than how it was portrayed. And so I would tell folks that this will be a really important tool. And then the final thing is just this AstraZeneca, they're giving it in Britain. They've given a lot of doses of this. The FDA's making them go back and do American data when they have data in other parts of the world. I just wonder, why not try to get that on a fast track so that could be yet another option for folks? Because I'm not sure how much is going to be produced right away. I know Johnson & Johnson's under contract for 100 million doses. I don't think that that's going to be on day one. I think that's going to take several months. But even if they have 10 million doses by February, March, that'll make a big difference. That'll help a lot of folks. So Johnson & Johnson, very positive. We're looking forward to that. Obviously, we're going to be ready. If that is approved, we're going to look for our allocations and want to put that to very good use very quickly. So I think there's a lot of great news that's happening. If you look in Florida, the COVID situation, throughout the whole winter respiratory cycle, our per capita hospitalizations were significantly lower than states like California, New York, some of the other, these lockdown states. And what we've seen here, and I think some of it's seasonal, some of it is community immunity, maybe some of it's vaccine, but we've seen huge decline in hospitalizations over the last 2 weeks. The admissions have gone down dramatically over the last 2 weeks, and we hope that that trend continues. But we're right now, I think we probably, over the summer, we peaked at nearly 10,000 COVID positive patients in hospitals statewide. In the winter respiratory season, a completely open state where we trust people to work, live, do as they see fit, we reached 7,700. So 25% less than what we were over the summer, and much less per capita than many of these other states. And now we're going down dramatically. I think Seniors First is part of that. But I can tell you this, the more seniors we vaccinate, the lower that hospitalization number is going, because those are the folks that are most likely to need admission to the hospitals. So that's a really good trend. And really, the two things we've looked at the whole time, I don't get bent out of shape about these positive tests, because if you test 200,000 people, you're going to get a lot of positive tests. So that's never been the barometer we've used. We've used emergency department visit for COVID-like illness. That peaked on January 3rd. It's been going down for the rest of January. And then the hospital census, which peaked in the middle of January, has been going down the last 2 weeks. And so those aren't trends unique to Florida. COVID is receding everywhere in the United States. Now, maybe that's seasonal. Maybe it'll come back stronger in the spring. We obviously had a summer wave. Maybe that's something we'll have to contend with. But I think that with the vaccines continuing to be put out, I think it's going to be harder for COVID to really have a serious spike when you combine the people that have natural immunity through infection and then the vaccine. So we're making some really good progress as a country on this. The state, we're doing, I think, well, and we want to keep those trends going as we go forward. So the Villages drive-through site, it was so successful. We said if you use it, we're going to work to get you more. Finally, we're able to get another 41,000 doses on top of our normal allotment. This is a beneficiary of that, as well as the community in Broward and Tampa, and we're going to keep doing it and keep working hard, putting seniors first, and not resting until every senior that wants to get a vaccine is able to get a vaccine.